Hello everyone, welcome to my YouTube channel, Not Me with Vajahat. The first topic that we are going to study today is clavicle. First of all, I'd like you to know that the textbook we are going to follow is L, and we'll be using this 3D model in looking at different aspects of the anatomy and now specific clavicle. So let's start, and this is your clavicle bone, which is part of your upper limb. It is usually studied with the upper limb and it lies just above your thoracic cage. You see, this is your right clavicle and this is your left clavicle. The first question that arises is that would you determine the side of the clavicle? Which side clavicle is this? If an examiner hands you over a single clavicle, so how would you know that this is this? So, if we see it from the superior end and if we see it from the inferior end and if we isolate it, let's isolate this. If you see, this bone is placed like this. I just zoom out and then zoom in again. You can see that this bone is placed like this, and let's isolate it. So this is placed like this. And if you observe that on the right side, the medial end, this is your medial end and this is your lateral end. So the medial end is convex forward while the lateral end is concave forward. Okay. So the medial end is convex forwards while the lateral end is concaves forward. Similarly, if you see that this is the superior side, this superior side is rather very smooth. While if you look at the inferior side, so there are different costal tuberosity, subcostal subclavian groove, and the conoid tubercle, trapezoid line. So there are different structures present over here. But on the above, you on the superior side, you do not see many structures like these. Okay, so if I see the whole picture, so if you see it from the front and from the superior view, you can see that the smoother surface lies superiorly, while the surface which has the subclavian groove lies inferiorly. Okay, so this is the right clavicle and it has a convex medial end while the lateral end is concave. Okay, so now we'll just go through the text. Clavicle, also known as the collarbone, so it is also known as the collarbone, is the key is located between the sternum and the scapula. So it is located between the sternum, this is your sternum, and this is your scapula. So it is located between these two bones and lies horizontally across the root of the neck. So this is your neck and it is lying horizontally in the root of the neck. It is roughly S shape. So if you can see from above, it is a rough S shaped. It makes an S and resembles a large old style key. So it resembles a large old style key. The clavicle forms a light strut that connects the upper limb to the thorax and allows the limb to move freely from the trunk. So the clavicle forms a rod that connects your upper limb to your trunk. It is the first bone to begin ossification. So this is very important from MCQ point of view, that it is the first bone that begins ossification and it acts like a strut or rod that transfers the forces from your arm or upper limb to the trunk. The clavicle is subcutaneous and easily palpable along its entire length. So it is easily palpable and you can palpate your clavicle easily. Let's move forward. Sternal extremity. So now we are talking, if we isolate this, so there are two extremities. We are looking at it from the superior and this is your sternal extremity, sternal facet. This is your sternal facet or sternal end, and this is your acromial end. This lies on the medial side while this lies on the lateral side. So the sternal extremity, the sternal end is a blunt, thickened, it is a thicker side, while this is the uh, roughened and what do you call it, this is a bit rounded while this is a bit flatter. Okay. Sternal extremity is blunt, thickened, proximal medial end of the clavicle. It articulates with the clavicular notch of the sternum. So if we see the whole picture, so you can see it attaches to the sternum, and if we remove these, so it attaches to the sternal notch over here with the sternum. So the sternal end, this is your sternal rounded end, thickened end, attaches over here with the sternal notch. See both sides. Okay. Isolate it by a, by a compound synovial joint containing an articular disc. The acromial extremity, this is your acromial end, this is your acromial end, this acromial end is a flattened distal end of the clavicle. So this is the distal end of the clavicle. Conoid tubercle, it articulates. So sorry, this end, acromial ends articulates with the acromion. If I remove the isolation, you can see over here that this bone is articulating with the acromion. This is your acromion end, this is your acromion, this is spine of the scapula, and this continues as acromion, and this is your clavicle. So this here is making your acromioclavicular joint. Okay, and over here the sternal end is sternoclavicular. Conoid tubercle is a small roughened elevation of the ear surface near the acromial end. If we see superior side, isolate it, isolate this bone and see towards the inferior surface. So on the inferior end there is a tubercle, a ruffled, a small roughened elevation ear surface near the acromial end. This is known as conoid tubercle. This serves as an attachment for the conoid ligament, which is part of the coracoclavicular ligament. This is a important ligament. Let's see this ligament. So we will have to switch a different slide, different model. If you see over here, if I zoom in, see over here. So if we remove, let's see that if the ligaments are not available here. Let me switch to yes. You can see the able to see here the C clearly visible here. This is your conoid ligament. See from here, see it from here. This is your conoid ligament, which is a part of your costoclavicular, coracoclavicular. Okay, so this ligament arises from the coracoid process and it is attached to the clavicle, the conoid tubercle. This is your coracoid process, and this is clavicle, and this is your conoid ligament, which is actually a part of a coracoclavicular ligament. And this is the trapezoid ligament, which is attached to the trapezoid line. If we isolate this bone on the inferior surface, there is a trapezoid line, and this trapezoid line uh, is the second part of the coracoclavicular ligament attaches over here, which arises from the coracoid process and attaches over here. Okay, now let's move forward and see the diagram in the text. So if you can see this diagram, so this diagram in pink you can see the origin of the muscles, while in the uh, blue you can see the insertions of the muscles. So if we move to our trunk and we see the muscles, so this is the posterior end while this is the anterior end of the clavicle, and this is superior view and this is the inferior view. So this is anterior, this is posterior, this side is the posterior, this is the superior view, and this is the inferior. If you see just medial, on the medial side, there is the origin of a pectoralis major muscle. So if you see in this diagram on the clavicle, if we hide the platysma muscle, so we can see that this is the origin of the, with the sternum, the pectoralis major is giving rise to, sorry, the clavicle is giving rise to the pectoralis major muscle. Okay, so you can see it over here. And if you see on the superior surface, there is the origin of sternocleidomastoid muscle. If I zoom in, so you can see this, the sternocleidomastoid is originating, one part of it is originating from the superior end of the clavicle. Okay, so now here if you see on the lateral end of the clavicle, you can see the origin of deltoid. So if see the fibers over here, they are marked like this. I just correct it. So see on the lateral end, the deltoid gives origin, the lateral end of the. So now if we see its inferior end, so pectoralis major also arises from the inferior end too. Okay, and if I, the deltoid also arises from the inferior end. So the pectoralis major plus the deltoid are arising from both the superior and inferior surface. Its fibers are arising from both the surfaces. And if you see over here on the lateral and superior view, you can see the trapezius muscle. Trapezius muscle is inserting over here. So you can see this is the trapezius muscle which is originating over here and it is inserting on the clavicle. So this blue shows here that it is inserting over here and you can see this that it's in here. And the subclavius muscle, as you can see, this is the insertion of subclavius muscle. If I hide this muscle, if you hide this muscle, so it's originating from the first rib and then it is inserting on the subclavius groove is present posteriorly on the, which is present, this is your subclavius muscle. If I isolate this, so you can see this is the subclavius muscle which is originating from the first rib and it is inserting just near to the conoid tubercle on the, in the inferior surface. Okay, I hope all the muscles and ligaments are covered. Now let's move towards the clinical fractures. The clavicle. So the clavicle is a strut. It is a rod that holds the arm laterally, so it can move freely on the trunk. So it helps your arm transferring the force. So it transfers your total force of the arm to the trunk. It is the sole link between the upper limb and the axial skeleton, and so transmits all the forces from the upper limb to the trunk. Okay. Unfortunately, because of its position, it is easily exposed to trauma. Okay, so as it is present on the anterior side, so injuries that occur anteriorly, they may injure this, fractures may of the clavicle occur. It is the most commonly fractured bone in the body. This is a very important that this is the most commonly. The fracture usually occurs as a result of fall, shoulder, or outstretched hand. So if a person falls on his shoulder or outstretched hand. So what is outstretched hand? I This is an image showing a small kid which fell on his outstretched hand. So if he falls, if a person of if a boy falls, so he'll be falling on his outstretched hand. So fractures usually occur when the person falls on either or outstretched hand. The force is then transmitted along the clavicle, which breaks at its weakest point. So there is a point that is weakest in the clavicle, and which point is that? This is the point. So if you divide the clavicle into three parts, this is the medial one third, this is the middle one third, and this is the lateral one third. So over here, just in between this part, the middle one third, in between, 80% of the clavicular fractures occur over here, and this is weakest part of the. So it is saying weakest point, which is it? The junction of the middle and outer thirds. Okay, so junction of the middle and outer third. So most of the fractures occur over here, and the junction of the middle and lateral third. So this is the most weakest part, while the fractures most almost all 80% of fractures occur over here. And now what happens when then this fracture occurs after the fracture, the lateral fragment, for example, if a clavicle is fractured over here, if a clavicle is fractured over here, so this would be the distal or lateral fragment, while this would be the medial fragment. So what happens is that after the fracture, the lateral fragment is depressed by the weight of the arm, and is pulled medially and forward. Okay, so the weight of the arm, what will happen that this fragment will be hanging down and forward and a bit medially by the strong adductor muscles of the shoulder joint, especially the pectoralis major muscle. What will happen is that the weight of the arm plus the adductor muscles would displace this lateral fragment a bit downward, downward and medially. And what would happen to the medial end? The medial end is tilted upward. So as we studied that the sternocleidomastoid muscle in previously we studied that the sternocleidomastoid muscle arises from the superior surface of the medial end. The sternocleidomastoid muscle will pull the medial end upwards. So if we see a radiological image of the clavicular fracture, so if you see that this is the lateral end, which is a bit downwards, while this is the medial end, and the sternocleidomastoid muscle pulls this medial end upwards. Okay. Now the close relationship of the supraclavicular nerves to the clavicle may result in their involvement of the callus formation after the fracture of this bone. This may cause persistent pain over the neck. So, for example, if there are supraclavicular nerves passing through here, there are supraclavicular nerve passing through here. So, if there is a fracture and after some callus formation, what happens is that there is persistent pain over the side of the neck. Okay, this side of the neck, the side that is fractured. So, I guess that's it for the clavicle. We'll be studying different topics in detail later. I hope you comment and share your views. How did you like my video? Thank you.